few minutes to be able to, as we close in on the end of 2023, be able to share the accomplishments of our various businesses and organizations and groups out there, including Corewell Health. And Drew, it's always nice from a resident, from a consumer out there, to be able to know how well is our local hospital doing. And so I guess without it sounding like a state of the state, but is our hospital here, Corewell Health, is it in good shape? Tell us about that.
We are in good shape at Ludington and at Gerber both. We've done very well, and we have happy staffs, and I'm happy to report that things have, for the most part, stabilized since COVID. I don't know if you remember a few years ago, we were trying to figure out how to hire people and keep people working. And people have really come back to the workforce, in my opinion. And it seems to be more stable and happy place to be. And we're moving forward, and we have some great projects that are going to.
And looking forward to that. And so over the next few minutes for our listening audience, and we've listed a few of these items on our Facebook page and as well as our YouTube channel. And you can listen to this segment. You can also watch the segment. So listen to it on your radio, 99.9 or at 102.7, where you're airing it over our frequencies there. You can listen over your smart devices like your Amazon Alexa, your Google Home, and of course, video streaming at our Facebook page, WMOM, and Hot Country Hits, and right there on our YouTube channel. So interact with us if you have any questions. But let's go through this. And I think one of the biggest items, at least on my mind, is the new cancer center that's going to be unveiled, I believe, next month. Is that correct?
Yeah, next month. It's coming in January. We'll have our opening, and starting around mid-January, we'll start to see patients there. And it's really come together well. And remember, that is, I'm so thankful to the community because over $1 million was contributed to that project because of the community and the foundation. And just the work that they've done. And cancer touches everybody's life at some point. Basically, 1 out of 2 people will be touched or either have cancer scare or have someone very close to them that has cancer. So we want to make sure that care is provided right here locally. And now you'll have a space where it's just a very holistic place to be treated.
And can you take us through just kind of a sneak peek of what people can expect, what the features, because we did have a cancer center before, but the one thing that sticks out for me was it was kind of small, right? It was just a smaller space, and this is just total opposite of that.
Yeah, it was tight in there. If you haven't had the opportunity to go through there or had anyone you know go through there, it was elbow to elbow, quite literally, when it's a busy day. So that wasn't conducive to good healing or people being relaxed. So everyone's spread out now. There are little walls between people who are getting treatment. We have a private treatment room. So if somebody has a need for quiet space for some reason, or they need to be away from everybody else so they don't get exposed to a cold or something like that, we have that space. One of the other things I think is a huge feature we never had, we have outdoor space now that people can go and maybe not this time of year, although today's not bad. It's going to be a beautiful space, a healing garden where people can go and spend some time quietly and be outdoors while they get their treatment, because sometimes you're there for 3, 4, 5 hours and it gets boring sitting in there, and we recognize that. The community really paid for that.
Looking forward to that, and that's going to be unveiled. Is it early January or later January? Can you share that with us?
Right in the middle of January.
Okay.
We'll be having a ribbon cutting right around the 11th, and then or 13th, and I gotta keep my calendar straight. But following those days, we'll be up and running and able to take patients into that unit.
All right, looking forward to that, and we'll be out there to cover that ribbon cutting ceremony that's taking place. We have the all new inpatient floor that has, if I'm right, there's individual rooms. Obviously, now more convenience like showers and other amenities there. Take us through the reason for that and what we can expect there.
Yeah, for years we didn't have a shower, not one shower in any of the patient rooms. So to have a shower when you're there for an extended period, you had to walk down the hallway. It just wasn't very convenient for people to do or private. So we've added those. We've updated the rooms so that they're technologically smarter and ready to grow and move forward with as technology develops and gets even better. We're doing more with telemedicine, and we can actually take care of people through the ICU through the television, basically, and it's quite good. And then on our ICU unit, which is actually going to be open in February, it's been closed for a year. That is going to have bathrooms for the first time ever. We never had a bathroom, pardon me, in any of those rooms. So that was really is demeaning, really, for people to have to get on a commode. We recognize that. So we've always wanted to do that, and now we're doing it. So I'm really, really excited about this.
That's pretty powerful. If you're just joining us, we're talking with Drew Dostal, president of Corewell Health, Ludington Hospital, and Gerber. And let's focus on Fremont for just a moment. You have some expansion in the urology area, both in Ludington, but also in Fremont there too, right?
Yeah, absolutely. We finally are able to, with Dr. Reiser taking on a nurse practitioner, we're able to expand down into the Fremont area again. Dr. Reiser used to go down there, and it was just too much for him to handle both caseloads. So now we're expanding that, and his reach is going to be that much further because of that. And we're really excited about this too, because obviously, traveling is not fun for anyone. So if we can bring even just the follow-up appointments closer to home, that helps. So we want to do whatever we can to make life easier and just access and care be simple for people.
Love it. And it's always good to hear. And that kind of brings us back to what we had talked about earlier about as a community, we like hearing these new additions, these expansions, especially at our local hospital. We had one of our listeners jump in online who was an employee at Corewell and said, good morning. At work already at Corewell, the dietary nutrition services and preparing delicious food and lifting people's spirits during the holidays, and that's pretty powerful to hear that. And I would assume, Drew, that the staff, they're there day and night. They are there during the holidays, and sometimes from our standpoint, we don't remember them that much when we're hustling, bustling, and shopping and all of that stuff. But they are there if we need to come in and visit them at any moment, right?
They are. I always remind our staff this time of year, they're a lot like Santa Claus. They see you when you're sleeping and they know when you're awake.
Yeah, absolutely.
and so, yeah, they're there. And just having someone call in from dietary, they do an amazing job. We were really blessed to be able to feed what we call a great fallness meal, a little pun there, to the staff, just to thank you for the year that they've done and celebrate the holidays that are upcoming. And the food was amazing. Thank you to everybody in dietary again. It's just really great. And the staff love that. So any thank you they get from people, they're still there and they're still pulling for you. They're there for you. That is why people work in the healthcare industry.
It's pretty powerful for sure. And we thank them for all that they do. We're talking with Drew Dostal from Corewell Health, Ludington Hospital, and Gerber Memorial. Let's go just further down a little bit on the WMOM and Hot Country Hits, the listening territory there, down into the Whitehall, Muskegon area, right there on the fringe. And there is a new addiction services that is offered by Corewell Health there on the north side of Muskegon, right?
Yeah, that's right. Addiction medicine has really grown through the years. As we all know, the treatments have gotten better. And just the way that we approach substance use disorder as truly a medical condition instead of a byproduct of using those medications and becoming addicted, we've recognized that the addiction actually is the disorder. So we have a really good staff down there who sees patients about 4 days a week now, sometimes 5. Mm-hmm. And it's busy, and you can get in there if you need, or if you have a loved one that needs to continue care, we can do that there. There's a really good outreach resource there. And we can do a lot of stuff through telemedicine as well. Mm-hmm. So there's the ability for counseling to be done pretty much at home. So that's really our goal is to, again, that's that simple piece. Everything we do, we're trying to move towards that, making life better for people so they don't have to travel.
And that clinic walk-ins are available as well as an option, and that we always look at the movies and the TV shows out there about trying to get somebody help immediately, and to be able to have that availability right there in the Muskegon area, and it's pretty powerful. Not that anybody can't walk into any of the hospitals and clinics for Corewell Health, but it's nice to be able to have that attention right there in the Muskegon area.
Yes, exactly. That's true. And if you're a Corewell patient and you are in that system, it's easier to keep your care in one system, and it's just a long way between here and Grand Rapids. And if we didn't have that ability, it's a long ride. And now that help is there, as you mentioned. That's a great point. Is that at that halfway point, or a little more than halfway from Ludington, a little less than halfway from Gerber, there's care right there.
All right, awesome. We are getting a few more comments on our Facebook page, and it's kind of heartwarming to see some of these. Jamie just thanked your Corewell Health employee, and others said thank you for what you do, and happy holidays. So it's good that people are recognizing that those healthcare workers. Adam said, Drew, my dad would be so proud of what you've accomplished, and he says a Merry Christmas to you as well.
Well, thank you.
So it's nice that we see and we hear those that are recognizing the healthcare workers. The accomplishments at Corewell Health continue. You brought in Mary Ivey, which I believe we had on the air, right?
You did. Yep. Yes, that's right.
And she's new to the hospital system. And then you have Elizabeth Bolzman, I believe.
That's right. Mm-hmm.
She's starting in 2024. Can you talk about them?
Yeah, absolutely. Elizabeth is actually in the Corewell Health training right now. So she's learning her family medicine rotations and getting her work done in her residency, and she'll be joining us when she's done. And she'll take a short break. All those folks that come out of residency, they all graduate on the 1st of July. And so she'll take a short break and then probably join us. I think she's planning on September, last I heard. And so that'll be great to have her. Obviously, just another resource for everybody. We're going to do some shuffling of space because we're growing, which is good. But we need to make sure everyone gets seen. But we don't have enough room, so we're trying to be clever. And as the cancer center moves and gets out of that space, you may see some changes as patients to people coming into the hospital. We haven't defined that yet, but we're working very feverishly to make sure we have a plan. So that's been great. And then Dr. Mary Ivey has been a wonderful addition. She's seeing lots of people and trying to get out into the community and know people. She's a wonderful person. If you haven't met her or had the opportunity to interact with her, she is a breath of fresh air, and she's always very upbeat, and she'll tell you the way it is, but you don't feel bad at the end of hearing how it is, and you walk away educated. And I really appreciate that about her. She has a very good way of doing that. I've heard a lot of positive compliments about her demeanor and the work that she's turning out.
All right. A great expansion in the OBGYN area of Corewell Health. Let's talk about a few others. If you got a few more minutes.
Absolutely.
All right. Let's do this. Accomplishments at Corewell Health. And before we even get into some of these others, this isn't an opportunity to say, hey, let's pat Corewell on the back. It's really an opportunity for you, Drew, and everybody that's in the healthcare system here in Ludington and in Fremont to say, hey, you know what? We've expanded the options and the services and the availability so that it's more convenient. And I would assume that that's really the breakthrough or the message that you want to get out to people today, right?
Exactly right. And Chris, everything we do is because you tell us as patients and family of patients, you're the ones who are open with us and telling us, hey, this is working for me, do more of that, or this is not working, don't do that. Mm-hmm. And so we love to hear that. It's feedback that we really, really need to make sure that we're bringing healthcare that's meaningful to you. Otherwise, we don't want to create something that just spins its wheels and really isn't bringing value. So we want to make sure that we're wise stewards of dollars in healthcare as well, and that the folks that come are really needed. So that's what we've really tried to do. So thank you to the people out there who have shared your opinions and your thoughts. It's made a big difference.
And it's nice to see that, hear that, read about it. We're seeing it on our Facebook page right now, WMOM and Hot Country Hits. Just the the care that is mutual, right? From the caregivers and from the community that supports those caregivers. Speaking of that, there's a community health screenings and classes that are offered through Corewell Health. And that, I don't know how long that's been a part of Corewell Health, but at least in the last few years, it's been something that we've paid attention to because I think it's just been more available for the community, right?
It is available. It's very available. As COVID, knock on wood, subsides, it's more accessible. And we've been doing it for a long time. A lot of people have gone through the Safe Sitter courses or had basic life support done through the hospital, or even if it's health screenings, we can do that as well. We have wonderful community nurses who can come out and help any organization or group of people that are looking for that. So, yes, it's very accessible now, and I love to see that people are using it. And I run into Kelly, who is our nurse, in the funniest places. Sometimes I'll see her and she's like, hey, I'm going to do a little, whatever it is, biometric screening day for this group of people. And it's kind of fun to see her out and about. So keep using that resource. And if you need it and you can't get a hold of it, please just reach out to me or anyone in administration, and we can definitely point you in the right direction.
All right. Looking forward to that. And from the expansion in the cardiology area to the support groups like the cancer, Parkinson's disease, Alzheimer's disease, and stroke, there's more availability. There's more resources. We were just talking with one of your employees. There's thanks for honking as you go by. Just about a month ago. In regards to making sure that walkers were available and other resources. And so it's not just the management level in the hospital. It is truly those healthcare workers that want to see this more available. Another honk, thank you, for this expansion in the services, right?
Yeah, absolutely. We caregivers do what they do because we want to provide care. We want to show off what we can do for you, and we want to make sure that we're thinking about those things. So our frontline workers are the ones who really bring good feedback for us because they hear things in the moment that we don't necessarily hear in administration. So we rely on them to do that, and they're the ones who drive a lot of this, and they see the things that are needs. And they help direct us into those lines of business, whether it's, like you said, helping people get a walker or just making a connection with, the veggie van or some cooking services, whatever it is. And we just really appreciate that.
That's great. And you'd mentioned the veggie van, but there's something that I didn't know in regards to this, and that is the 700 bags of free fruit and vegetables. I would assume that's connected to that veggie van program, but they were also delivered to seniors and senior centers throughout the area too. Not just for the community to come out, which was great to see that, but also for those that might be a little bit more confined to their homes and their spaces.
Yeah, that's exactly right. We really want to make sure that people who don't have access to really good fresh produce, that we help do that in some way. And we partnered with the YMCA out of Grand Rapids years ago to start doing this. And they've been phenomenal partners, and really they've created this really broad reach. It's not just even in the Northwest region, is what we call the region that I have. It's all over the place. And I've really been impressed myself with, I see news articles about it sometimes down in the southern part of our system. And it warms my heart because it is hard to have access. Sometimes that stuff's expensive. I mean, we all know prices have gotten higher, and to be able to provide some sort of relief for people is just what we want to do. So it's been a wonderful partnership that hopefully we keep up for a long time.
That's fantastic. If you're just joining us, we're not done yet in regards to the accomplishments that Corewell Health, Ludington, and Gerber has achieved this past year. We also want to look at what we can expect for 2024, and I think that's there's some exciting points that are coming there. But one thing that we want to make sure that we recognize is the Dare to Dream Gala event. That's a huge fundraising event, and then also the recruitment of the 2 nurses for the midwives program there. Do you mind highlighting on both of those for us?
No, I don't mind at all. So the gala always is kind of a high point in the community for what we do anyway. It's the first Friday of August every year. And it's always fun. It's always imaginative what the team comes up with to do for a theme. Whether it's sometimes it's dressing up. I know that in the past we've had Mad Hatter themes and things like this. And sometimes it's just wearing, dress clothes or whatever. And that's fine. But it's really about going out and having fun, getting a group of people together, maybe buying a table. All that money goes right into whatever we're working towards that year. This year will be cancer. So know that your money is going towards that. Stays local. Mm-hmm. A lot of people worry that, gosh, if I give money to the hospital, is it going to go down to Grand Rapids? It does not. It does not. It stays local. So just know that the foundation is still local and here for you. As far as the nurse midwives, we've never had nurse midwife service here. And it's something that people have asked us to do for a long time. Well, since I've been back, I've been hearing more and more people who have requested it. So we've made that a reality. We have 2 nurse midwives that will begin in January. They'll be working very closely with Dr. Ivey and Dr. Gentry and make sure that we're expanding that service. They approach deliveries and women's health and care of the unborn child holistically. They just really look at things kind of as a whole picture. It's a better way for some to seek their care. Some people like traditional methods, and that's great too. But there are a lot of good techniques out there. I've been impressed with just the knowledge that both of these folks have gone on to get. It's impressive that they go on for masters and doctorates, certifications. They start teaching. They write papers. They're quite scholarly. So that's a service we're happy to bring very shortly, and you'll be seeing more of that as we get them on site and get them up and running. We have to get them plugged into the system. It takes a little while. And then we'll make sure that we start getting their names out there and opening the doors for you to make them an appointment. Come see them.
All right. Looking forward to that. Anna just asked about the Veggie Van schedule. We'll post that and some of that information right in our comment section on our Facebook and our YouTube channel. And then also a great resource is the Corewell Health website right there and social media channels.
Yes, absolutely. Watch that. We always talk about when the Veggie Van will be around and where. And that's and it's okay if you travel. You don't have to be from that particular area. If you happen to be in North Muskegon and it's there, you can actually go to the Veggie Van there.
Yeah, very exciting. First of its kind, or one of the first of its kind, you partnered with West Shore Community College, and we were talking about this in a segment I think about a couple months ago. The pre-licensed apprenticeship program with West Shore Community College. Take us through that for a moment, and how big of an event is that for Corewell Health?
It's very big. I'm going to give credit to Shelley Booz from West Shore Community College and Malia Mariani from the hospital, our CNO, as you've met on this show many times. They worked together to create the first apprentice program in the state of Michigan for nursing. There's been an apprenticeship for the trades and some different jobs for years. And it's always been a very smart way for people to learn what they're doing and become really masterful at that skill. And so they began talking about this some years ago and made it a reality. They worked with the national licensure organizations and the state licensure organizations and the governor, and all kinds of people were involved to make this happen. And so it's a big deal. And people sometimes think, oh, that's great. No, this is a big deal. And for Ludington, Michigan to lead the way on this, it's huge. And so we're having 2 nurses, the future nurses, that are in that program. We've hired them, and they'll be starting. One of them started, and the other one will be starting hopefully very shortly. And they're nurses who are going through the program at West Shore Community College. Future nurses. I keep using the term nurses, okay. But they're nursing students. And what we do is we take the opportunity for them to work at the hospital, make some money while they're doing that. But that's not the important part. The important part is actually what they're learning. They'll be teamed up with very skilled nurses who have 30 years of experience, most of them, and they will learn what those folks have that you will not always learn in a textbook. When you come out of nursing school, yeah, you're ready to practice nursing, but you have a lot to learn. This way, we're hoping to shorten their learning curve, get them off of orientation much quicker, and just create more of a pipeline. It's good for the kids at the college, and it's a great opportunity for us as well. So my hats are off to West Shore Community College as a partner with Corewell Health.
All right. If you're just joining us, Drew Dostal, President, Corewell Health, Ludington Hospital and Gerber. And two more things before we wrap up 2023. You received your primary stroke center certification from the Joint Commission. That's a huge achievement. And then also began expanding services. Sometimes we always think, Corewell Health just focusing on Ludington and Mason County, but no, the palliative, I hope I said that right, palliative care services and hospice service expansion in Oceana County, as much as an expansion here in Mason County too, right?
And that's right. Those two go hand in hand, and sometimes people confuse them. But palliative works very closely with hospice to make sure that people have the best experience, which is towards the end of life most of the time. And these people have the ability to really help you navigate confusing waters sometimes as you go through it. Anyone who's been through the process know the challenges that exist. So palliative care can get you resources that you didn't know were out there. And frankly, I didn't know were out there. They're just amazing people who have vast amounts of knowledge. They also can treat pain to help control that, or nausea, or whatever the case may be. So they have the ability, they have physicians that can prescribe and make sure that you are getting what you need or get you to another resource. Mm-hmm. So to get into Oceana County has always been a big goal of ours, and that became a reality just recently when they said, yes, we're going to expand into those areas. So I'm really, really excited about this too, and just hopeful that it'll bless some families out there.
All right. We've talked a lot this morning about 2023, but there probably is some focus that you're looking forward to personally and professionally as the leader of Ludington and as well Gerber in Fremont for 2024. Do you mind sharing that with us?
Well, that's a good question, Chris. I have a lot of hopes for the future. Obviously, I think as we go forward, we really want to make care. We want to make sure that it's affordable. That's a big thing that we're focusing on this go around. Access is huge on in my own personal list of goals. Making sure that people can get where they need to be. We're working on a few ideas that I don't want to share yet until they come out of the incubator, as it were. But I'm hoping that will be an amazing way for people to gain access. We're trying to make things easier, even at the front door. I know many people have used the kiosk, which isn't terrible. It's not great, and we know that. So we're looking at ways we can make that faster and easier for you, and we're trying to dream big and be innovative. So my goals are thinking outside of the box and just trying to bring in some of the stuff that other folks are doing, or even thinking of new things that they haven't even thought of. So we're really trying to lead the way.
And you've been continuing the branding. I saw the new sign up on US 10, and your address is actually 1, right?
It is.
Yeah.
It's 1 Atkinson Drive. So that little road that drives up to the hospital is Atkinson.
Yeah. And because I saw that little number 1 on it, and I'm like, are they missing any other digits? But no, it is. But in all seriousness, you have the one epic ecosystem that you're looking forward to. I would assume in 2024 as part of the expanding the electronic side of it, the digital side of it within the hospital system too.
Yeah, that when you hear one epic ecosystem doesn't mean anything to anybody really, except for us. It's as we've come together with the Beaumonts, with the former Beaumont system, we had to get onto one system so that anybody who goes across our healthcare system is having the same experience, and we have the same ability to treat them because all the information will be shared. Mm-hmm. There's a lot that goes into this. All of our resources have been poured into that, and that'll be hopefully done. We're doing some super user training coming up here in the end of the first quarter. So it won't be long. We'll all be on there, and we can start working on some other projects, which is great because this has been exhausting, even for us way up north. Even though it feels like we're not in really part of it, we are.
Well, and it sounds like it's there's a lot. There's a lot going on, and there's a lot of focus on community, and as well your staff members making sure that, because they went through COVID, we were talking about that earlier this year, that there's spikes and that happens, and they're dealing with some spikes now in some of the flu season, COVID. And everything else that they have to deal with. But I would assume, and I ask you to leave us with this message today: is what's your message to your team that you would say if you were in front of them right now as a staff, and then also if you can speak on behalf of them to the community. Would you do that for us this morning?
Yeah, absolutely. I'd love to do that. So for my staff, obviously, I would just tell them, they know it. I think that they are the most amazing team that you will find. Small hospitals are the best kept secret in the world, in my opinion. I love the fact that we have that personal touch. I see what they do every single day. People don't make it through our hospitals without a hello or can I help you find what you need to find? And that is something that is a value proposition that they bring to work every single day. We don't train that. They just do that. And they're really great people. And I'm very thankful to them. I know that none of this is possible without the hard work that they do every single day. Mm-hmm. And for the community, I think that the staff would share that same sentiment with you, is they appreciate the support that you give them. They love the fact that you choose us. There's a choice. You don't have to come to Corewell Health, and we know that. And but yet you do. And so for those of you who come, we thank you. For those who don't come try us out. Every day we're trying to get better and bring new things, as we've mentioned in this segment, and I appreciate that. So we're really thankful for this community. We're thankful for the community in Fremont and Nuevo County as a whole. They've supported us in ways that go beyond measure. So we just really appreciate that, and we look forward to doing the same for you and far into 2024 and beyond.
All right. Great message there. Drew Dostal, President, Corewell Health, Ludington Hospital, and Gerber in Fremont. We appreciate you taking some time with us this morning, and happy holidays and Merry Christmas to you.
Thank you. You too, Chris.
All right. It is just after 9 o'clock, 9:05. We'll break for news, weather, get you caught up on that, and launch the 9 o'clock hour. Coming up next